Good evening, everyone, and welcome. So wonderful to have everyone in attendance here tonight. Feel free to find a seat, and don't be afraid to sit up toward the front so you'll be able to hear everything and see everyone here on the stage here. So let me thank you once again for coming out tonight to join the conversation to knock out opioid abuse here in Middlesex County. These statewide events are hosted by the Partnership for Drug-Free New Jersey and Horizon Foundation for New Jersey. I'm your moderator for this evening's events, the morning show host at 1450 WCTC and a member of the New Jersey Broadcasters Hall of Fame, Burt Barron. Welcome tonight. And to all of you in attendance, today is the 13th of a total of 17 town hall meetings that will be held in communities throughout our state to address the opioid epidemic and also to help develop solutions. New Jersey, as you know, is in the midst of an opioid abuse epidemic. And not a day goes by without hearing or seeing a story in our neighborhood or in the media on the impact of the misuse of prescription medication, heroin abuse, the countless overdoses impacting all of our communities, and of course so many of our families who are dealing with the day-to-day challenges of this disease. Middlesex County is not immune. No family or community is immune, and today and tonight we gather to learn how we can address this epidemic and how we can prevent more of New Jersey's residents from becoming addicted. Also, how we can reduce stigma, how we can help those who are addicted, and how we can support those in recovery. Please welcome at this time Angelo Valente, the Executive Director of the Partnership for a Drug-Free New Jersey, to say a few words.
Thank you, Burt, and good evening. The Partnership for a Drug-Free New Jersey and the Horizon Foundation for New Jersey is pleased to bring this conversation to Middlesex County this evening. Tonight, along with our hosts, the East Brunswick Municipal Alliance and the Middlesex County Prosecutor's Office, and our collaborating partners, Wellspring Center for Prevention and WCTC, the Voice of Central Jersey, we thank you all for joining us for this important conversation. There are no easy answers. It is necessary for all of us to work together as a community to try to come up with ways to eradicate the epidemic that is changing, most importantly, changing the public attitude towards addiction. And this change will begin today. Will ultimately reduce and prevent opiate abuse in Middlesex County and throughout the state. So I want to thank you again for joining us here and joining the conversation. It's now my pleasure to introduce our sponsor for tonight, the Horizon Foundation for New Jersey, Dr. Paul Alexandra, the Vice President and Chief Medical Officer, Government Programs for Horizon Blue Cross Blue Shield of New Jersey.
Good evening, everyone. I am here because it's an honor and pleasure to speak on behalf of Horizon Blue Cross Blue Shield of New Jersey at tonight's Town Hall. Thank you for your interest and your attendance to this meeting. As the state's largest insurer, and I would say committed to the state of New Jersey, Horizon Blue Cross Blue Shield of New Jersey has dedicated a lot of its resources and its efforts to addressing the opioid crisis within the state. And we are the proud sponsors of tonight's Town Hall. And we've been working closely with the partnership in terms of Partnership for Drug-Free New Jersey in the educational programs throughout the state. The Town Hall series is funded, again, through the philanthropic arm of our company, that is the Horizon Foundation. Since its inception in 2004, the foundation has awarded more than 1,300 grants to nonprofit organizations. The most important of these grants has been this partnership in terms of Drug-Free America. As a physician, an ER doc, this is very close and dear to my heart because I've seen the challenges of opioid addiction and the way it impacts families, friends, neighbors. It's something that is a bit overwhelming, and each of us probably knows one person who's dealing with this, I'll call it a disease. The Office of Medical Examiners here in the state of New Jersey identified over 2,000 drug-related deaths due to opioid addiction and use. And that exceeds the experience in the state when you look at traffic accidents, when you look at gun violence, and others. So this is a very serious disease. New Jersey has the sixth highest rate of emergency room use for opioid addiction. Tonight you will hear about the use of drugs such as fentanyl, which is about 50 times stronger than heroin and used quite widely and increasingly in the state of New Jersey. Through our collaboration with the Partnership for a Drug-Free New Jersey and other state, local, nonprofit agencies, we are really committed to combating this opioid epidemic. At Horizon, I'm in government programs. We deal with Medicaid, Medicare, people who are in need of long-term support services. We really are trying to identify our members that are at risk. We're working with docs, trying to limit the number of prescriptions they prescribe that might actually lead to opioid addiction. I want to thank the organization for collaborating with us in terms of the Partnership for a Drug-Free America of New Jersey, as well as with the other agencies in the state. On behalf of the Horizon Foundation, I just want to thank you and wish you a good meeting. I think looking at the speakers, this is going to be really interesting. So thank you.
All right, Doctor, thank you very much. Next up to welcome us here to this beautiful school and this beautiful auditorium, please welcome the Mayor of East Brunswick, Mayor Brad Cohen.
Good evening, everybody, and I too want to welcome you to the Joanne Magistro Performing Arts Center for this important discussion this evening. It's a dialogue more than actually a discussion, and my background, of course, before I even entered any type of public office was in, and still is, in the medical field. Saw that from drug abuse from the time that I was a resident or a medical student in Newark to the time that I was resident down here in New Brunswick. I dealt with that issue as a Board of Education member here in East Brunswick, and now as mayor of the township. This is a endemic problem. It is not specific to East Brunswick. It's a national problem, but the dialogue has to be done locally. And we cannot ever believe that we're so immune that the problems that occur all around us can't possibly happen here. So you need to be proactive, and these type of programs are exactly the type of dialogues we need to be having in order to address this very, very important issue. So I want to thank our alliance for putting this program together, and all of the speakers and moderators and promoters who have been so instrumental in bringing this program to you. I won't take up any more of your time and rather spend more of it with the professionals here to give you advice. But thank you again for taking your evening and coming out here and sharing and discussing this very important topic.
Thank you, Mayor. At this time, please welcome our collaborating partner for tonight from Wellspring Center for Prevention, Ezra Helfand.
Hi, everyone. Good evening, and I'm here to officially welcome you to East Brunswick, which is where we reside also. And I have a feeling that many of you may not be aware of who we are, so I urge you to go to a table in the back, meet our staff, and learn more about the services we provide right here, in fact, on Cranberry Road. We have been in this community for 37 years. We have been doing a lot in terms of prevention, providing prevention at the school level, and going all the way through some of the older adult facilities in the community. I am very proud of the fact that our former colleague, Linda Sirks, is one of the people who's responsible, not necessarily for this particular event, but for instituting the drug take-back, which we partnered, or today we partner with the DEA on, and also establishing the collection boxes that can be found at 15 municipalities at the police stations throughout the county. So that's the kind of work we do. We're very proud of it, and we want to make sure that you get to learn a little bit more about us. And in fact, today, you may see on the news that the governor has announced a partnership between the state and Rutgers University, and we happen to be an important component of that, to provide training to 200 individuals who will become trained, certified alcohol and drug counselors in the very near future, which will go a long way towards stemming the opioid epidemic. So welcome, enjoy the evening, and thank you very much.
And last but not least, before we bring our panelists up to the stage to begin tonight's program, we have three very special heroes in our midst here tonight. And they're here to talk about a very special program, and they happen to be from the East Brunswick Police Department. Please welcome Captain Joseph Alves, along with Patrolman Jason Fama and Patrolwoman Agnes Garnkars, here to share details on a groundbreaking program here in East Brunswick. Welcome, officers.
Good evening. My name is Patrolman Jason Fama, and I'm here today with Captain Joe Alves and Patrolman Agnes Garnkars. It is an honor to be here representing the East Brunswick Police Department, and we are very grateful for the opportunity to have Drug-Free New Jersey, along with Blue Cross and Blue Shield, bring the Knockout Opioid Town Hall Series to East Brunswick and have it opened up to all Middlesex County residents. We cannot stress the importance of having these discussions about opioid addiction take place. We believe education is the key to prevention and stopping the problem before it could happen. For the past several years, the East Brunswick Police Department has been carrying the nasal naloxone spray in all of our patrol cars. If you're unfamiliar with this drug, it is the drug that is given to individuals that have suffered overdoses because of opiate use. This has given us the ability to render immediate assistance to victims of opioid overdoses upon making contact. Although Narcan has been great at helping save lives, the challenge that remains is how do we provide real treatment and real recovery. Myself and Patrolman Garnkars are currently assigned to the Community Policing Unit and serve as active members as the Municipal Drug Alliance. In January of 2016, the East Brunswick Police Department was one of the first agencies in the state of New Jersey to launch an opiate outreach initiative. Our initiative works through a partnership with PARI, which is Police Assisted Addiction Recovery Initiative, along with SOBA College Recovery, to place participants into treatment. The Community Policing Unit serves as the liaison contact between the person and the treatment centers. Our program seeks to proactively engage in outreach activities to known addicts by offering support and resources to addicts, their families, and loved ones. Our agency outreach program identifies local residents who are determined to be at risk due to a previous history of drug overdoses, known addictions, and officer referrals. Since the launch of this initiative, we have had several success stories, and we continue to work hard at trying to provide help for individuals who are in need of treatment. Once again, the East Brunswick Police Department would like to thank Drug-Free New Jersey for bringing this town hall series to East Brunswick, and specifically opening it up to Middlesex County residents. I would like to thank all of our panelists for participating tonight. And lastly, I would like to thank the East Brunswick Drug Alliance, along with all of the co-sponsors, for your hard work and dedication to fighting the opioid crisis.
All right, officers, thank you so much, not only just for being here for tonight, but what you do day in and day out in East Brunswick. Thank you so much. You please join me in a round of applause for all of our opening speakers. Thank you. At this time, I would like to invite our panelists to please join me on stage, and we'll begin our program coming up in just a few moments. I would also like to pass along some very special thank yous. First of all, to Dr. Valesky, the superintendent, for the use of this space when is hosting the event here tonight, so many thanks for that. Also, thank you to the County Alliance Coordinator, Arola Castanos Beaton, for all the assistance in organizing and supporting this event here tonight. And a very special welcome to the Sheriff of Middlesex County, Mildred Scott, who is joining us here tonight as well. Welcome, Sheriff. Also like you to know that today it's as much about hearing from you as it is about hearing from our expert panelists who are joining me on the stage. We want you to share the issues that are impacting you, and we want you to know what's going on in your community, things that are happening and things that maybe could be done. And the questions that you have, the recommendations that you'd like to share. But first, we're going to hear some brief introductory comments from our expert panelists. And first, let me introduce our panelists who are here. First of all, we have the prosecutor for Middlesex County. Andrew Carey is here. Welcome, prosecutor. We have two very hardworking legislators for the state of New Jersey. Is that my cue for something? Two very hardworking legislators from the state of New Jersey. First, let's welcome State Senator Joe Vitale, who is here. Welcome, Senator. We're getting ready for our annual softball game loss that we get every year. And also New Jersey Assemblywoman from Central Jersey, Nancy Pinkin. Welcome, Assemblywoman. Also joining us on stage is Mara Carlin from Wellspring Center for Prevention. Welcome, Mara. Vanessa Vitolo, the Outreach Coordinator, Victory Bay Recovery Center, and Reach NJ is here. I know her. She's on TV, right? You saw her, too. And also Dr. Bonnie Noland, Woodbridge Township Addiction Services Coordinator. Welcome, Dr. Noland. And welcome to all of our guests here tonight. We'll begin with a question for Prosecutor Andrew Carey. And again, welcome, Prosecutor. Can you please give us a snapshot of the opioid abuse epidemic as it stands here in Middlesex County, and give us it from the law enforcement perspective, if you would?
Sure. I'd like to start by backing up a little bit and give you a little bit of my background as well. Thank you for having me here. I appreciate the people sponsoring tonight's event. Incredibly important, and we have a very good turnout tonight. Thank you for being here. I've been quite involved in the drug problem for my whole career as a prosecutor. I started as an assistant district attorney in Manhattan, assigned to special narcotics, kind of at the tail end of the crack epidemic. And when I moved over to the federal prosecutor's office, I was head of the narcotics as well. And now as the county prosecutor, I see a whole other side of the opioid epidemic. And there's much to be done, but we've come a long way here in Middlesex. Drugs is simply the leading cause of preventable deaths. And as you look at this panel, you see everybody up here, you say, why is the prosecutor here? My job is not to put as many people in jail as possible. My job is to protect the community and to work with folks like these up here to make sure everybody's as safe as they can possibly be. In Middlesex, we recognize that there's really a three-prong approach that we have to take when we're addressing the opioid epidemic. The first, of course, is education. If you can keep people from having a drug problem in the first place, they never have to quit, which makes a lot of sense. I've had the pleasure of being with Angelo on stage several times in Middlesex County to address different groups in terms of education. We've talked to dentists, we've talked to doctors, we've talked to educators, we've talked to law enforcement, we've talked to the faith-based community, just to let them know what's going on and what we can do to make things better. A lot of the importance these days is put on pain management and reaching out to the doctors and the dentists. Prosecutor's Office has also sponsored our own forums where we address such people as superintendents, principals, and law enforcement. And we recognize that when it comes to places like this, a middle school, the solution also is here where the problem lies. So we try to work with school counselors. We try to work with school resource officers to really help kids and teachers when they need help. In terms of education, law enforcement, we need to educate ourselves as to what the problem is so we can address it. It was already mentioned the DEA Take Back, where we take back pills that nobody needs anymore. We're very proud of the work we've done. We have many police departments in Middlesex County that take those pills, pharmacies as well. But across the country, the last DEA Take Back, they got 456 tons of unused drugs. And if we're at the point where we're collecting 456 tons of unused drugs, we need to step back and see what are we doing wrong. Why are we producing that amount of drugs? Why are we prescribing that amount of drugs? Why are that amount of drugs out there who could hurt somebody? In terms of the snapshot of the problem here in Middlesex, we recognize that prescription drugs a lot of times are the gateway drugs. Addiction starts at the pharmacy instead of a back alley. Here in New Jersey, consistently for the last 20, 25 years, we've had a heroin problem. New Jersey users use heroin. We've tracked the heroin. Heroin used to be produced in such places as Colombia, Afghanistan, and would get trafficked through Mexico up to New Jersey. Now it's a little closer. A lot of the heroin, the actual heroin, the plant, is being produced in Mexico, and it's coming straight here to New Jersey. Once we identify the source, we can do something about it. There's a drug, fentanyl, which of course is more powerful than heroin, that is often mixed with heroin, cocaine, methamphetamine, and the amount of fentanyl that we see is killing the people that are using it. Even worse than fentanyl is something called carfentanil. And 1 grain, something as small as a piece of salt, can kill. It's a synthetic opioid that is 10,000 times as strong as morphine. And we're seeing carfentanil show up. The only good thing about the drug being that strong is that the drug dealers aren't sure what to do with it. They don't know how to dilute it. They don't know how to get it through the mail without killing the mailman, without killing their own dealers, and without killing themselves. But carfentanil is something that's extremely, extremely dangerous. It comes most of the time from Asia, and the dealers, since they don't know what to do, we're a little bit ahead of the problem, but we have to keep moving on it. The second part of the equation here is treatment. We need to continue to get treatment, and everybody here is dedicated to that. We have to understand that the mental and physical problems associated with addictions go hand in hand. We have many new programs here in Middlesex County, and I'm very proud of the work that we've done with the county officials, our politicians, everybody, to get the help when people need it. With that, though, as a chief law enforcement officer, I recognize that where there's money set aside to help people to do good, there will be fraud. If you look at the opioid counseling centers in Florida, there's a lot of them that are fraudulent, a lot of them that don't do what they're supposed to do. We're very vigilant and we're aware of that, and we're hoping to track the money and track the problem so we can stop fraud. All of our police agencies here in Middlesex County have Narcan, that's naloxone, that can undo an opioid overdose. Here in Middlesex, we're on par to have about 500 deployments just by the police alone. That's not in the hospitals, that's not an EMT, that's just by the police, and it's about 95% effective, meaning we revive the person. But of course, when we revive the person, we need to get them help and we need to get them counseling. And there are new programs in our hospitals that we're very proud of, and I thank specifically Senator Vitale and Assemblywoman Pinkin for helping to get those programs and the Narcan and the replenishment in place. In terms of dealing with the courts, we do have a drug court. And with bail reform that you've all heard about, there are more people that are, instead of going into jail where they would get immediate treatment, they're back out on the street. We need to help those people earlier on to get the help. We can't tell them, please don't do heroin for 9 months. We'll get you a program down the line. We need to get them programs earlier, faster, and better. And we recognize that there has to be a true partnership between the health, education, and law enforcement. And the third part is that I and all of our officers and very well-spoken officers, I know how much you enjoy speaking publicly. You did a good job, Jason. We need to do true law enforcement. I, like everybody else, recognize that we cannot arrest our way out of this program, but we must investigate and prosecute those that are responsible for who profit from drugs and are responsible for the violence and the death that comes from drugs. Those are two very real things that happen with drug dealing, and we have to address it, because those who are truly responsible, who are making the money, who are responsible for the violence, do not care that our citizens, our brothers, our sisters, our kids, our parents are dying, and we do. I was recently at a murder scene in New Brunswick of a young man who was killed over a turf war having to do with drugs, and seeing that person laying there on the ground, hearing their phone continuing to ring, knowing that it was his parents and brothers and sisters trying to figure out where he was, it hits home. It's real. We have to address it, and we have to aggressively prosecute. I thank Senator Vitale for your work on the Overdose Prevention Act. We have a great law that people need to know about. If somebody's overdosing, you call 911, and the police aren't going to arrest you. And on the tail end of that, if somebody is supplying the drugs that kill somebody, I can arrest them and I can prosecute them. And law enforcement, we have to keep moving. We have to keep figuring out what the trends are. And community forums like this, where we can work together, are very, very important. So I can assure you that I will continue to do my part, and we will aggressively target those responsible. We will work to educate and get treatment. And if there's something I'm missing, please call me. Please call my office. We have people that'll be happy to talk to you if you have any good ideas. And I look forward to continuing to work with you and everybody on this panel. Thank you very much.
Thank you, Prosecutor Carey. That dovetails perfectly into our next panelist here. Senator Vitale, welcome. And I was wondering if you could just talk about the ways that you and your colleagues in the Senate are addressing the opioid epidemic. I know the prosecutor talked about a couple of programs, but if you could embellish on that, please.
Sure. Thank you, Bert. And thanks to the school and to the Arts Center for having us here, all of you for coming out tonight. And part of what's important about you being here is that you understand that you're here, which is important, to understand the issues and the challenges in every community, so that you can spread the word and be part of the solution. This is an epidemic that has taken years to get to where it is today. It's going to take us years before we turn the corner. So I think we need to be realistic about what the challenges are. Where sometimes we get distracted by other issues that come up in our lives. Whether you have a family, you have things to do, or another issue that takes precedent over this one. This one's not going away until it is that enough people are into treatment, in recovery, and then we begin to really reduce the demand. Because really, at the end of the day, this is a supply and demand issue. Without the demand, there is no supply. And so it was about 3 years ago or 3.5 years ago when the CDC, which is the Center for Disease Control and Prevention in Atlanta, really announced formally that we're in the middle of a heroin epidemic, an opioid epidemic. And so as chairman of the Senate Health Committee, I thought it was my responsibility as the chair and also with my colleagues to begin to work with Assemblywoman Pinkin and others on what is a legislative strategy. Someone said to me, well, how are you going to write a law to change all of this? But this isn't just about writing laws, it's about writing laws that affect policy and the way in which that we approach how to deal with helping people. So we really established 4 prongs to the approach, which is education, treatment, recovery, and prevention. You can't do one without the other, in my view. Just to do treatment is important, but if we're not dealing with prevention and educating people, then we're failing on the front end. And so we really set out very early on to understand the issue. And so I met with, and my colleagues met with addiction experts, with law enforcement, with others, to understand how to approach this. Because we are going to spend a lot of time, a lot of resources, but we need to act quickly as possible. And so I authored about 18 bills so far, more than that, but 18 bills that have been signed into law so far. And some of them are long-term strategies, because this is a long-term problem. But one of the first ones that I had sponsored was as the prosecutor mentioned, the Overdose Prevention Act, which allows someone to call 911, not fear prosecution, but also provide naloxone, the antidote, to first responders so they can be out in the field and saving people. But the question really became, what happens next? So we're literally saving people every day with their reversing overdoses. We're losing people, but we're also saving people. But the next question is, well, what next? And we've revived someone from an overdose. Then they immediately begin to detox and looking for their drug again, and they're a little agitated that they're no longer high. And so we, with the governor's help and support, we established the recovery coach program, and so we have those individuals who are in recovery meet with those who have overdosed to sort of commiserate about their issue, as opposed to me or a police officer or a doctor or a nurse who they can't relate to. And so that's been very successful in getting people into treatment. But those are sort of the shorter-term strategies to address the issue for someone who's overdosed. But the longer-term strategies are, pardon me, how it is that we educate ourselves, educate the medical community who prescribe opioids, and educate children. I thought it was important that whatever we did, whatever law we wrote, whatever policy we wanted to change, was really based in the evidence, like what works. Maybe I'm too old. We didn't have the DARE program when I went to school, but the DARE program is a helpful tool for very young children. But we need a strategy in our schools that is long-term, that's based on the evidence where it works, and is also appropriate to a grade level. So one of the bills the governor had signed that had written requires the State Department of Education and the Division of Addiction and Substance Abuse to write curriculum changes for the entire school system, starting in elementary school and going all the way up to high school. Because frankly, we talk to children in 12th grade differently than we talk to kids in 6th grade. And so we develop a curriculum and it's not just 3 minutes in health class, it's sort of woven into the curricula during the course of their entire school year. But it follows them as they get older and older and they get into high school. And I think that's an important strategy, at least one strategy. We did that with seatbelts, we did that with alcohol. Alcohol-related deaths, meaning car accidents, are greatly reduced because over time we educated the public in terms of why it's bad to drive when you're drunk or drinking. We have designated drivers. Even the alcohol and beverage community began to buy into this as a public relations thing, but also to save lives. And so over time now, we see many less auto or deaths related to drunk driving in New Jersey. So these strategies work over time. And so, but it's an important element. We have to be patient with how it is that we talk to ourselves and talk to kids about this, but have to make it that longer-term strategy. One of the other pieces of legislation that we're going to do this year, after January, is a screening tool for children in all grade levels, starting in rather middle school and high school. And it's a verbal screening tool. It's not a urine test. It's a verbal screening tool, and it's effective in states that use it. I had some time it took last year and went up to Gloucester, Massachusetts to look at that program. Between the school district and the mayor and the council, they've literally gotten hundreds of people into treatment, identified folks who are at risk through this communication model, and are being able to bring these folks into treatment. So we're going to try to employ that in our school districts throughout New Jersey over time to identify those kids who are at risk, who might be using or experimenting, so that we could help them and intervene if certainly their parents or their family wants us to or want the intervention. But to catch kids early, and their kids are using drugs earlier and earlier, and they're experimenting. Kids are kids, and they all make mistakes sometimes, and drugs are one of those mistakes that they make sometimes, and opioids are enormously addictive. And so we want to be able to have that strategy going longer term. I can go on for a long time about the bills that we've done and the strategies that we want to still employ, but when we talk about these strategies, we also have to think about and talk very openly about the provider community and the pharmaceutical industry. The pharmaceutical industry, there's one or two main institutions or companies who were the main suppliers of opioids, OxyContin, Oxycodone, and some of the others. And they did it in a manner that really brought shame to the company and shame to those who own the company. They were pushing these drugs on doctors, telling them that it was the next best thing since sliced bread. And so over a period of time, literally years, the medical community bought into this notion that pain was a vital sign, that we had to treat pain regardless of the consequences in many cases. And so literally they addicted hundreds of thousands of people over time. The prosecutor talked about how many tons of drugs were found, were brought in as a buyback or a bring-back program. That many prescribed literally every day. So we've worked with the medical community, the medical society here in New Jersey, and they get it too, but just to understand that we have to be smarter about what it is that and how much it is that we prescribe. One of the bills the governor signed last year that I wrote reduces the amount of opioids someone can be prescribed for acute pain. So chronic pain is long-term pain. You have a chronic back problem, you have a chronic whatever problem. Acute pain is short-acting. You've had an accident, a broken bone, a tooth extraction, whatever it is, it's short-term. It usually lasts from 1 to 3 or 4 or 5 days. So we required them now. You can no longer prescribe an opioid for acute pain for more than 5 days. And if you need to prescribe more, you have to go back to the doctor. You've got to make your case so you can get more. But before that, in so many cases, and I'm not sort of indicting the medical community because so many of them are doing a great job, but there were those who would just prescribe just to prescribe. They thought it was the right thing to do, or they didn't want their patient to be in pain because they cared about their patient. But what happened was they become dependent on these drugs, and they're incredibly addictive. Some people can, and Bonnie and some of the others will talk about this later, because they know the science better than I do, about how quickly you can be addicted to an opioid. And so for many people who have overdosed, and I tell you, we started talking about this 3 years ago, that this isn't, this is an urban issue. It really never was. And now that it's in every community in the state, we're certainly talking about it more freely, but we have to understand that it's not just limited to one sector of the community. It's everyone, it's everywhere. It's white, it's black, it's brown, it's men, it's women, it's young, it's old. It's the highly educated, as well as those who don't have great education or lower income. It goes across all socioeconomic lines. And so when we limit the amount of supply, we're also helping people along the way not become addicted. What happens when someone is prescribed an opioid for a medical reason and unfortunately become dependent on that drug, they can no longer be prescribed by the provider. The doctor says, we're going to have to cut you off, you've had enough, and maybe your pain is really make-believe, you really just want the drug. They'll go on the street and try to buy it there in the black market or the gray market. But the cost is so expensive, depending on the demand, you can pay up to $20 or $30 for one pill. And when you run out of money and you've sold all your jewelry and your car and everything else, heroin is much cheaper. It's around $5 for one we call it deck of heroin, one hit of heroin, as opposed to $20 or $30 for a pill. And so you're addicted to heroin, and then it's a real game changer for most people. And as the prosecutor pointed out, it's not just the purity of the heroin which was killing people initially, it's now fentanyl and carfentanil that they're adding in to really boost the effect of the drug. And in some cases I've heard that they're just using baking soda with fentanyl in it. Forget even about the heroin. It's just baking soda, a little bit of fentanyl, and that's the drug of the day. And so and I'll stop in a second, but I just want to say that we're working on these strategies, and those are a four-pronged approach to this. It's taking care of people who are also in prison for drug offenses they have their own substance abuse disorder. They're in for a nonviolent crime, or that crime drove them to violence. But, an addiction and having a substance abuse disorder is a disease. And we've acknowledged that finally. And we're trying to remove the stigma. So whether you're in jail, whether you're living in $1 million home, whether you're white or you're black, this issue affects everyone. And so over time, with all the strategies that we try to use and we are using, and those that we're going to continue to employ over time, one day we'll see light at the end of the tunnel, we'll turn the corner. But until we reduce the demand, we'll always have the supply. We'll always have literally hundreds, if not thousands of people in New Jersey who needs to seek treatment, which will, for most people, will be a lifelong struggle and a lifelong challenge. Heart disease, someone has heart disease, they'll have heart disease for their entire life, and depending upon how it is that they treat themselves and take care of themselves, they can live a long life. If you have a substance abuse disorder, whether it's opioid pills or it's heroin or some other drug, it's still going to be a lifelong challenge for you. For some a little bit, and for some a lot. But it's something that Nancy and I and others in the legislature are working hard to try to get our head around strategies that will actually work over time. And we're all going to need each other's help to get this thing in the right direction. So being here tonight is a big step in the right direction, so thank you for that.
Thank you, Senator. Well, obviously, lots of programs and lots at play in the Senate. For you, Assemblywoman Nancy Pingen, can you talk about some of the efforts that your colleagues in the General Assembly are doing to address the epidemic?
Well, thank you, Bert, for asking that question. This issue has been long in coming, and I think the thing that's changed is that the drugs themselves, as was said previously, are so incredibly potent. I mean, we've had addiction before. One of the issues that have come up over time is that we weren't really worried about it when it was in urban areas, but now that it's everywhere, now all of a sudden everybody's giving it attention. But it's kind of been a give and take between all the different groups to try to figure out what we need to do to address it. And everybody hasn't always been on the same page. When we looked at over time, the prosecutors and people in the police arena were thinking, well, the doctors are doing bad things, and the legislators sometimes stick their 2 cents in and say, well, we have to do more for pain, and maybe it was the pharmaceutical companies, but it was really everybody had a little part in it, both in creating it and trying to prevent it and feeling the effects of it. I mean, there's nobody really immune. So when we talked about, there was a package of 21 bills that were put in, and we said, well, we've been asking for drug treatment programs. We've been asking for coverage under private insurance or Medicaid or Medicare for treatment. That didn't exist. When we did mental health parity, really we never had, we didn't have treatment for mental health services previously the way we had treatment for other diseases when we talk about insurance coverage. So these were things that people in the legislature, people in the health communities were asking for that really wasn't available. So then and again, there's always a check and balance. So there was fraud. When you start putting in treatment programs, then everybody's going to treatment, and do they really need it? But one of the things we learned while people were trying to regulate that, the treatment wasn't really long enough. Now we realize that it has to be longer. When we looked at things like, well, when you take somebody that goes back into the community after they went through treatment, why didn't it work? They might have the best care, but they're back in their environment where the drugs are available, and that's a problem. So one of the pieces of legislation had to do with substance-free housing, both substance-free high schools, substance-free housing on the college campus. When you go to college, you're not really around where your parents are, you really hadn't been supervised before. All of a sudden, if you have a drug problem and you go through treatment, Now you go back to your dorm or back to wherever, and you don't really have the defense mechanisms to be able to combat that. When we talked about the issue of the take-back medications, we really started out really just doing it like a day a year, and then it went to quarterly, and then it went to every day. I worked in the communities that I'm in. East Brunswick was one of the places that did it first before most other people did it, to have a, how many people know about that, that we have a vehicle right in front of the police department that anytime you have medication, if you don't need it, drop it off? Are people aware of that? Okay. Well, you should. You know, I have been advocating for years through my work in healthcare to have medication locked up. We went through a pretty good program of training people to lock up their alcohol, but yet we've got all these prescriptions right in the medicine cabinet or at the parents' house or the grandparents' house. And we ourselves, everybody individually, has become much more cavalier in the use of medication. So we have to take responsibility as well. You know, people are at a party and they say, oh, you know, I have a back problem, I hurt myself at work, and somebody else says to them, well, you know what? Here, I have this left over from the doctor, I had surgery, I don't need it, you take it. And we sort of moved away from that control and that stigma of taking a narcotic or using a narcotic, and we became very cavalier about it. We became cavalier about leaving the medication around, cavalier about taking the prescription. And then at the same time also more drugs. People weren't really being given a prescription for like 4 pills or 10 pills just to get you through. You would get 30 pills. And now we realize, looking back, that that's really a big mistake. We realize that people were, what we're doing in the healthcare community is we're trying to work more closely with all the different parties. We started out where as Senator Vitale said, where if you called up and you had somebody with a overdose, if you would call up, you'd get arrested. So if you're yourself involved in that drug event, you're not going to do that. So that sort of changed that so people could call to save a life. When we started talking about the Narcan, well, when we said, well, the police are the first ones on the job, let's use Narcan. And the police didn't really want to. They were like, well, why should we use Narcan? We're not healthcare providers. We're not doctors and nurses. We can't be doing all this stuff. But we realized it was a necessity. Now, I don't know if you want to work with me on this, but I was at a drug program the other day, a training program for healthcare providers, and we were talking about doing Narcan over the counter. You know, when first the laws that were in place were that you could not have a medication, you would have to get a prescription, you just couldn't have medication like Narcan laying around. It just wasn't something that non-licensed professionals were allowed to do, but we realized it was a necessity, and the risks were not as much of the risk as dying from the drug. The people that are dying because of the respiratory suppression, and the Narcan reverses that. But then we realized when we reverse it, that then, you know, people are literally, and police can comment on this as well, they're like literally getting the Narcan, popping back up, and then they don't want to go to the hospital, they don't want to get treatment, they don't want to follow it up. So all of this has been a check and balance, but there's things that you can do. The most important thing for you to know tonight is to, what can you do? What can you do with your kids? What can you do with your families to make sure that you don't have this problem? Or if you do, what you can do to get treatment, you know, whether it's, you know, trying to be aware. When you know, one thing that struck me when I was reading through some of the emails that, you know, things on Facebook over the last couple days, is that when somebody's putting a notation about a side effect of a chemical, a side effect of the narcotics, people are writing in, and you see these pages and pages and pages on Facebook of I had this problem, I had that problem, and or I overdosed because I started taking too much, or one of the difficulties with this process is that if you have incredible pain, you have long-term chronic pain, the narcotics were created to be able to deal with that. Originally, it used to have to be that you got it by injection. That was the only way you can get that kind of medication. But then when it became an oral problem to treat the cancers, to treat the chronic pain, there are people that, you know, have been in auto accidents or things like that, and they have chronic pain, and those people are calling saying, hey, you know what, if you if you go too far with this, how am I going to be able to live? And it's really been a check and balance. But you can make sure that your kids have somebody to talk to, that if they go to a party, they have like a code word that they can use so you can go pick them up so that they're not getting involved, that you don't have them in your house, that if you do have it in your house, that you have it under lock and key, that you're not putting it in the medicine cabinet, that you're not sharing with your friends and not modeling that behavior with your kids, that there was a great program, I don't know how many people went to it, that was at the community playhouse, where they showed how to, a prosecutor came up from Newark, and they showed how to, go through, and you don't want to be spying on your kids, but you actually have to spy on your kids, and look through and see where they're storing the medications, where they're storing the narcotics, and trying to get professional treatment right away, and trying to read the product inserts. If you're taking a medication, read them so that you yourself know everybody's different. What are the warning signs? How can I have treatment but also know that, this is getting to be a problem for me? Or, when we talk about, one of the things we talked about was coverage of other type of services without using pain medication. Well, previously you really couldn't get covered for that. So again, we've tried to retool some of the reimbursement with the health insurance companies, with the laws, so that you can use other types of treatment whenever you have an issue with pain. And training, one of the legislative things that we worked on was starting to go down with the sports and the trainers so that people are not getting a narcotic, or if they are, they're heavily supervised when they're taking it. But our sports are so much more intense than they used to be. We're pushing our kids so hard, we have to wonder if that is having an impact. So, I could talk about, I have like pages and pages of bills that we put in to really address this problem. But I don't want to take away from the advice that the counselors can have, but we're here for you. If you have questions, you have ideas, it's something that really all of the community has to work together for, and you have to keep track of, your own family, make sure that you are taking advantage of the resources that we're trying to put into the community. There's a lot of money going into this right now. In fact, the governor made a new announcement today about a new training program for counselors, so we're really trying to retool the effort, but really goes back to the biggest thing is that these drugs are so much more potent than we've ever seen before. There's really not a second chance.
Thank you, Assemblywoman. Before we move on to our remaining three panelists, I would ask that they would just please limit their answers to between 5 and 7 minutes so that we have adequate time to take our comments and questions from the audience. Thank you very much. All right, moving on to Mara Carlin from the Wellspring Center for Prevention. Mara, could you please talk about the role that prevention plays
Sure.
in addressing this epidemic?
Absolutely. So I heard some of the other speakers talk about education, but what I do is prevention, and education is part of it. So I thought what I would do is kind of back up and talk about exactly what substance abuse prevention is. Most people don't know or think they know, and they're not sure. Whenever I talk about my job and what I do with my friends or people in the community, most of them are like, oh, so you're like, just say no? And I'm like, no. Like, oh, so it's like, here's your brain, here's egg, that whole thing. I'm like, no. Those scare tactics, actually, we know don't work at all. But there is science behind prevention. So what is prevention? Prevention is how we can reduce the risk of developing a substance use disorder. So most of the people that I work with on a daily basis are students in school, whether they're elementary school students or high school students or college students, but we also work with older adults in senior centers, and we use science-based, evidence-based prevention programs and strategies to help people develop skills so that when they are in a situation where they're deciding, am I going to try this? What am I going to do? They actually have skills to be able to say, talk about other ways of dealing with their feelings and their stressors. What we're seeing a lot in schools and with younger students is that they have no coping skills. And a lot of times without the coping skills, we all have stressors in our lives. If you don't know how to deal with them, a really easy way to deal with them is to numb your feelings. And unfortunately, using substances like opioids helps numb those feelings. So what we need to do is look at individuals, look at the school, look at communities, look at families, and really focus on reducing individual and community risk factors, and also increase the protective factors that each one of our communities and individuals and our families and our schools have. And that's really what prevention does. So prevention is not just education. Education is a piece of it, coming today, coming to a town hall meeting, talking about what's going on, but there's also community change and changes in social norms that have to occur also. Senator Vitale was talking about how with alcohol education and drunk driving, and we know that there's evidence that those worked, there is an evidence-based way that we are going to deal with this opioid epidemic. It's going to take a long time. If you think back to tobacco prevention and the Master Settlement Agreement, is anyone familiar with the Master Settlement Agreement? By way of hands, okay? Very similar to Big Pharma. Big Tobacco at one time was like, no, tobacco is okay. Tobacco is not harmful. And over time, we realized that we had science that told us how dangerous it was, and we used different strategies, community-based strategies, PSAs you saw on TV, education with students, building skills, resistance skills, and now we have the lowest rates of tobacco use that we've ever seen, and those continue to decline. So if we use all the information that we have from tobacco prevention, from drunk driving prevention, and we use that when we're thinking about how we have evidence-based prevention in our schools and in our communities, we really need to look at what we did in the past and what worked and use those in the future. We're doing some really good things. In East Brunswick alone, Wellspring, the agency that I work for, we've been here for over 35 years, doing different prevention programs in Middlesex County. East Brunswick has the Municipal Alliance, which does a lot of prevention programs. They have the Teen Alliance. There's a drop box, not just in Middlesex County, which you guys heard about before. So the social norms changing is happening, but we gotta keep it going, and it's really evidence-based and more than just education and talking, but it's changing policy. So you hear how in the state legislature they're changing policy, but it has to happen on the local level too. So we need to have people in the communities who are willing to actually come out and talk and fight for different community changes and policies as well. So thank you everyone for being here. It's so nice to see people in the audience that actually are here and want to make a difference. So thank you.
Thank you very much, Mara. Up next for Vanessa Vitolo, the Outreach Coordinator for Victory Bay Recovery Center, and of course you recognize her from her outstanding work that she does with Reach NJ. Vanessa, can you talk about some of the barriers to recovery? And there's a role that stigma plays in terms of this epidemic. Can you talk about that too?
Absolutely, yes. So as a person in recovery, the barriers to long-term sobriety are very, very familiar to me. When I first got sober, it was actually really, really difficult. Getting my license back, getting an apartment. I was refused for several apartments because of my background. Getting a job was actually very difficult as well. And that's why I believe a full continuum of care is so important. Supporting people getting back on their feet and not just doing a 28-day treatment program and then letting them loose to go back into society where people are turning them away due to the fact that they have a criminal record, which usually goes hand in hand with addiction. Something else that I think is really important in supporting decreasing the stigma would be sober living, which is really important, but people will acknowledge the problem, but refuse to have it anywhere close to them. It's actually a term referred to as NIMBY, not in my backyard. So everyone wants everybody to get sober, right? That's what they say. But when the sober living homes come close to them, they give it as much resistance as possible. I want people to realize that those 64,000 Americans that died last year of an overdose aren't just numbers, right? These are your brothers, these are your sisters, these are your children, these are your parents, these are your family members, your coworkers. And I think we lose sight of that when we just throw out a number. Also, what's really important is accepting people for who they are. Throughout this whole Reach NJ campaign, I've come across a lot of negativity. And not just for myself, but also for the people that are trying to get sober. I feel like it casts a shadow of doubt on themselves and who they are. And being able to stand up and say that you need recovery is not always easy. But when you have people so negatively commenting on the things that I'm doing, it could also make it hard for someone else. I think that grassroots organizations such as this and any forums that we have are super important to reducing the stigma. That's it.
Thank you, Vanessa, and continued success in your recovery also.
Thank you.
Lastly, we'll hear from Dr. Bonnie Nolan from Woodbridge Township, the Addiction Services Coordinator. And Dr. Nolan, there are barriers that occur when someone is seeking treatment. What can someone do to get help and try to overcome these barriers that they'll encounter along the way?
Thank you. As Vanessa said, just as there are barriers to recovery associated with stigma, there are barriers to treatment associated with stigma. So I think many of us are laboring under the misconception that if you just admit you have a problem, if you just hit rock bottom, then all these doors will open and you'll be able to go to treatment and you'll get the treatment you need and everything will be fine in 28 days. There are so many things wrong with that argument that I can't even begin to explain. It starts with the idea that a person has to admit they have a problem or that they have to come forward or they have to hit rock bottom in order to get treatment. Nobody goes into this willingly. Nobody becomes addicted to opioids willingly. Just as an aside, I have a PhD in neuroscience, and that is sort of what understanding how the brain works and seeing the physical evidence for addiction as a disease, mental illness as a disease, was what compelled me to come into this field and sort of share this information that substance use disorders and as a disease, it's not an analogy, it's not a sort of a model, it's a fact. It's a disease of the brain, and all behavior originates in the brain. So if you have a brain that has a disease, it's difficult to make proper decisions with that brain. So deciding to get into treatment is, for some people, that's part of the equation, but for many people, it's not. For many people, the families are getting the person into treatment or trying to get them into treatment. For many people, drug court is what gets them into treatment. That doesn't necessarily predict the outcomes. So the idea of getting into treatment and the idea of getting somebody into treatment first counts on people around that person having the right information and not assuming that they have to hit rock bottom, they have to decide for themselves that getting into treatment is the thing to do. It is often just as effective to have a family member force you into treatment. It's very effective to be put in treatment by drug court. It's a very, very effective program. So this is just one of those misconceptions that we've been laboring under that is a barrier for treatment. Now, as far as getting someone in treatment, when you actually want to get into treatment, there are barriers that are much more sort of concrete and easy to point to. If you are somebody who is a young person who's over 26 years old and you have a substance use disorder, you likely don't have private insurance. It's very unlikely that you have private insurance if you've had a substance use disorder for a long time. You may be living in your parents' home, but you probably don't have private insurance. So that limits you in the state of New Jersey to about 7 facilities. There are about 7 places that you can go for inpatient treatment, including detox, when you have Medicaid as your insurance. Now, what many people don't know is Medicaid doesn't actually pay for treatment inpatient. So it isn't that you're using Medicaid to get inpatient. The reason that you can get into these places is because they take state funding. I'm going to, just for a second, I'm going to get into a technicality that many of you may not be aware of. How many of you are familiar with the IMD exclusion? Okay, very few of you, right? So I think most of you would assume that Medicaid and Medicare can pay for treatment. In fact, since 1964, Medicaid and Medicare cannot pay for treatment in an institute for mental disability, and that's any institution that treats a mental disability that has more than 16 beds. So that pretty much eliminates inpatient treatment being paid for by Medicaid or Medicare. And many people don't realize if you have Medicaid, you cannot get Medicaid to pay for treatment. So you have to go into one of these state-funded facilities. And these are facilities that have a grant to accept a certain number of people. This funding is often month to month, sometimes year to year, but it's often month to month. So if you experience an overdose December 1st, you may be lucky because there may be some funding for you to get into treatment because it's the beginning of the month. However, the funding for the year may have run out. So it's really a crapshoot. It's really a very unfortunate situation for somebody who has Medicaid. You may be able to get in. Now, I understand that recently our governor applied for a waiver for the IMD exclusion. This is an option, and some states use this waiver. And in an emergency situation, it's an excellent choice because now people who have Medicaid can use Medicaid to get into residential treatment. There is one piece of that that's very important, though, and this is where stigma comes in. If private pay facilities, very nice, luxurious often, or even just average facilities, don't decide to take Medicaid as payment in response to this IMD exclusion waiver, then we'll be right where we started. Now that the waiver is in place, now that we are able to use Medicaid to pay for treatment, inpatient treatment, now the providers have to step up and say, okay, we will take patients who have Medicaid. They have to decide to do that. Now, I actually am pretty familiar with the Medicaid process. I know that it's not that difficult. So one way that you can help, if you're curious, to alleviate the stigma that might keep a Medicaid patient from getting into a private pay facility is if you happen to know somebody that runs a facility or works for a facility that doesn't take Medicaid, ask them why not. Just ask them, why wouldn't you take Medicaid? The rates are actually comparable. So why would you not? And the reason is stigma. There's a stigma associated with somebody who has Medicaid. And in this day and age, many people 26 and older have Medicaid. This is just the way it is. If you have private insurance, there are still barriers to treatment, and this is important to know. You could be in treatment. So let's say despite the fact that there's been really excellent legislation about not forcing people to get approval from their insurance company before they go into treatment. So pre-authorization is supposed to be not necessary. It's still sort of it's routine. Insurers are still asking for prior authorization before people can get into treatment. So you get your prior authorization and you get into treatment. There are still daily phone calls to that facility from the insurance company wondering why you're still there. So you could be in a facility that you're supposed to be getting 28 days and patients are there's routinely a revisiting of that authorization to see if you should still be there. You can be in a facility for 5 days as an insured patient, and somebody could be calling from the insurance company saying, how are you doing? Why are you still there? The reason that this happens, and in my opinion, and I don't think a lot of people would argue with me, one of the reasons that this happens is we are dealing with a mental illness. So you have people who are already dealing with, unfortunately, a certain amount of shame. It shouldn't be the case, but it is. They're dealing with a certain amount of shame. They may not want to be in treatment anyway. And now an insurance company is calling. They're maybe being pulled out of group or whichever treatment process they're in the middle of to go and talk to an insurance representative who's saying, tell me how you're doing, why are you still there? Your insurance is not necessarily going to cover the next 28 days. Eventually you get tired, and I've seen this happen with many patients, and it's heartbreaking. If they finally get into treatment, they get into a good place, things are going well. 20 days into treatment, they've just had enough of dealing with these daily calls and being pulled out of group and having to talk to the insurance company, and the insurance company's telling them that their time is up, and they just say, you know what, I've been here for 20 days, I'm okay. I'm not going to fight anymore. I can do this. 28 days is still too short. When somebody comes out in 20 days, their chances for success go down dramatically. So here we're dealing with the stigma that allows a person to feel almost shamed into sort of not spending this money anymore, not fighting anymore. Family members that don't know what to do, I mean, these facilities are very expensive, so they're not sure they can commit to, if the insurance company decides to stop paying, they don't know that they can pay the $20,000 or $30,000 that inpatient costs per month. So what ends up happening is the patient comes out, and more often than not, they relapse and end up going back into the same situation and maybe aging out of private insurance and ending up again with dealing with Medicaid. So even though it may not be readily apparent, all of this is related to stigma, and it's all related to us thinking of mental illness as a disease, as an analogy, and not really understanding that it is a physical disease. Mental illness is a disease of the brain. A substance use disorder is a disease of the brain. And all of us, it's incumbent upon all of us to demand the parity that we are legally entitled to. So those are the barriers, as I said.
Thank you, Dr. Nolan. And please join me in thanking all of our panelists for sharing their knowledge with us tonight. Some wonderful, wonderful information. Thank you to all of our panelists for being here. Now is the part of the program where we take comments and questions from our audience. John, would you be able to raise the house lights a little bit so we can see if people have their hands up? That would be very helpful. And just a reminder for you that tonight's event is being recorded. No, not for WCTC radio, but it is being recorded. So please, when we call upon you, just please wait for a microphone before you ask your question. And if you'd like to direct a question to one of our panelists in particular, please feel free to do so. And I guess we'll begin, woman right here. Go right ahead.
Hi, my name is Debbie. 34 days ago, I found my daughter face down on the bathroom floor from an apparent overdose of fentanyl. I received the autopsy report. There was no heroin, only fentanyl and tramadol. For the past 4 years, my daughter has been battling addiction, in and out of rehab, detox, and jail. She was offered drug court, and I have to tell you that drug court does not always guarantee that they're going to be clean. It is an everyday struggle, and if you come out of there with no plan, no sponsor, no NA, nothing, your chance of relapse is 100%. And my daughter had an apartment, she had a job, she was well liked, she had 1,600 friends on Facebook and died alone in the bathroom. And they could not revive her. They tried everything. She was still warm, and what I go through every single day, because I also lost my husband, and what I want these kids to know, that you will destroy your parents. It is a daily struggle to get up, breathe, eat, and go to work every single day, knowing I will never walk my daughter down the aisle. I will never have grandchildren. It is a living nightmare for me. I don't even want to wake up half the time. And these kids, my daughter said, I'm just going to try it once. I asked her to explain the situation, and she said the first time I tried it, I was like, oh, it's no big deal. I can handle it. It was really nice, greatest feeling ever. Second time, no big deal. I got a handle on it. Well, guess what? After 2 times, she had no handle. That was it. She started out with a bad back. She was at work. Somebody said, hey, I got a Percocet. You want to try it? It'll help your back. And it helped her. She loved it. And from there, we went on to heroin. Unfortunately, 28-day rehabs do nothing. 5-day detoxes at Bergen Regional do nothing. My daughter was offered drug court. She had several felonies. I had a very, very good lawyer. And New Brunswick at the time was going through this bail reform, and she spent 10 months in jail. And when she came out, she said, you know what, Mom? I have a new attitude. My brain is healed, and I'm perfectly fine and ready to start my new life. Her very good friends had no problem shoving drugs down her throat again. And I'm not blaming anybody. I'm just saying that it could be your best friend that could come up to you and say, hey, you want to do this with me? You want to try this with me? It's heartbreaking. It's heartbreaking, and I have to live the rest of my life without my daughter or my husband. And she's buried. Her ashes are buried in the plot that I'm supposed to be in. And you got to do something. These kids, to reach for an opioid with a knee injury or a back injury, it's going to lead to problems. And I've been stolen from. They broke into my car. They used drugs in my apartment. I mean, everything was taken from me, and I was still in her corner. And I fought to get her treatment. You can't throw somebody in the street after 28 days of rehab, telling them the same thing over and over and over. They're rehabbed out. It's not going to help. But that's my story. Please, kids, don't do this to your parents. It is a nightmare. Thank you.
Well,
Next
can I,
up-
can I just say,
Would you like to- sure.
you know, we're sorry for your loss and the difficulty that you went through. And your message is so important. As I said, this is like not something, this is not like the old days smoking a little marijuana or something like that. This is incredibly, incredibly addictive and so much easier to prevent than it is to try to rehab after the fact.
Yeah, I'm sure everyone shares the same sentiment. Thank you for your message, because really it's a message to all the parents and all the young people who are here today. I mean, and I've heard that same message over and over again, and it's just awful. And, the issue about treatment is very complicated. And for some, the period of time works, the residential treatment, as long as there, though, is something afterwards, intensive outpatient treatment, there's counseling, and they have the resources to pay for that. Maybe your insurance does or doesn't pay for that. Not meaning you, mean just someone. So it's some people succeed, some people fail, but it's that safety net that people have to have. If residential treatment is required of you, if you want to be in residential treatment, then it needs to be the aftercare piece of that. What's the plan for you after you get out, that very first day? Some individuals, and I'm a big proponent of medication-assisted treatment, so it's Suboxone and something else, and for lots of people that works. For some people it doesn't work, for most it does. And so, I just want to focus a little bit on your message about the residential part of this. And it did not work for her. It doesn't work for many people. For some it does work. But using the combination of residential treatment, medication-assisted treatment, Suboxone, which really helps. I know some folks who are on Suboxone as a way to deal with their recovery, and they function perfectly. They have to be committed to their sobriety. It's a very difficult struggle. But your message tonight is the most powerful one we can hear. What it does to a family, what it does to the person that you lost, of course your daughter, but what it does to the family. And thank you for sharing with everyone.
Did I see a hand go up in the back there? Sure, go right ahead.
Hi, I'm Michael Satterfield. I work for Soba College Recovery. So about 3 years ago, I actually got out of prison, and there aren't many things that are in place currently unless you're on parole. And I was actually lucky enough to get into a parole house, otherwise I would have just been out on the street. So I have a couple of questions. My brother also just died about 5 months ago, overdosed. And, I'm currently in recovery. I just graduated from Rutgers with the highest honors. I also was published by Harvard Educational Review twice now. Recovery is possible for individuals that really want it. And there's certain issues, though, that I've taken note of, both in the work that I do currently. The facility I work for, generally speaking, when I get parents on the phone that are looking for treatment for their kids, or I have individuals that are looking for treatment, there's a lot of barriers, especially with individuals with Medicaid, or even just individuals with in-network benefits for their insurance. And even certain insurance companies, they try and deny treatment after a certain period of time. So anyway, this is particularly for Senator Vitale and Nancy Pinkin. I took notes, by the way. All right. So anyway, what are we doing currently to broaden insurance coverage for people with substance use disorders, so insurance companies have to help individuals in whatever way that individual needs in order to become active in their own recovery? So, for instance, some treatment facilities can treat up to a year, like our facility, but a lot of the time, insurance companies will actually cut them short. After about 15 to 30 days, there's constantly like a back and forth between billing and the insurance companies as to whether or not the individual can stay in the treatment facility. So I guess I'll ask Nancy Pinkin instead, since Senator Vitale left. So is there current legislature to broaden what is being done by insurance companies?
You know, I think that the issue of insurance, again, this has been a learning process for everybody, and it's been cyclical. And I think even the insurance companies, you know, first of all, we have finite resources, right? So if we're not paying for drug treatment, we're paying for kids that have no food, or we're paying for education, or we're paying for schools, or we're paying for something. So there's a finite number. But I think the insurance companies themselves have learned through this process as it's gotten worse and worse and worse, and the drugs have been so much harder to treat the addiction. They've realized now that they had to change what they were doing as well. So it's really been something that we've all been working on together. It didn't happen overnight, but I think that their new philosophy is that they have to look at longer treatments. I mean, you can't keep somebody in treatment in a facility, for example, forever. So that's why we have to look at ways like, okay, do you have more counselors? Do you have somebody that's going to peer with you? One of the new focuses was to put somebody with you right in the emergency room to give you a contact. And there is a discrepancy about whether you have medication assisted or whether some facilities don't have that philosophy. I think the study of addiction and how we can treat it, some people are much more susceptible than others, is something that we need to do a lot more investment in. But it is a process that we've all been dealing with how to deal with it and how to pay for it and how to change in policy so that we can be effective.
Next question or comment? Front here with the white hat.
Hi, good evening. My name is Francesca. I have a background in public health and working within the community. My one point that I haven't heard a lot this evening is, where are the parents involved? I mean, this is happening in our homes, it's happening with our children and our loved ones. Where are the parents supposed to be part of the solution? That's my first part of the question. The other part is empowering the consumer, and that includes not only the actual patient, so to speak, but also the parents, the loved ones. Knowing the options, the different types of drug treatments that are available, the programs, what is intensive outpatient. These are foreign terms for people who are not aware of what these programs, how they exist and how they work. Never mind navigating with your insurance company and advocating. You need to educate the consumer, the patient, the parents, and the community what services are out there. I mean, if the parents aren't, you have parents here in the room, but you're not really talking to parents of how they can be involved and how they can better educate themselves. You've introduced lots of bills. Are parents part of those bills? How to better educate the parents?
So I'll answer the first part, where the parents. This room is, I don't know, maybe a little less than half filled. I do programs week after week after week that are geared towards parents, and they don't come. They're out there. They are, NICSL alerted. There's awesome programs, evidence-based programs that are out there, and it is very, very hard to get parents there. We go during parent-teacher conferences. We try and go when there's a play, and so we try and grab parents any way that we can. It's just, and if anyone has any ideas how you can get parents out to any prevention program, please let me know, because that is something that we struggle with. But I just also want to jump on when you were saying about friends. We talk to youth about like the big bad drug dealer down the street, but that's really not a reality. So to the young people here today, the most likely place that you are going to have the opportunity to experiment or try or use for the first time is probably with your best friend or your good friend, or at your home with an older brother or a cousin or someone that you absolutely trust. No one is born with a ticket on their toe that says, I have a genetic predisposition to addiction. I know I'm going to be an addict. You don't know, and it is a brain disease. So even just experimenting, using once with alcohol or tobacco can actually lead down a road of addiction. So just be, really careful. But to go back to the parents, it's just very hard to get parents out there. So we try and do whatever we can, however we can. But if you have any other ideas of how to get parents out and to listen, and we are definitely open to hearing that. So thank you.
So
Regarding
the
your
partnership
question-
also has a parent education program, so anybody interested in having a program for parents can also see me at the end of the program.
I think there's also a question regarding resources at the back of the room there. Middlesex County Health and Prosecutor's Office have put together, there's a pamphlet, there's some guides back there. Also, Partnership for Drug-Free New Jersey, if you just go to the website, they have a lot of great links. And reach out to your county officials and keep asking those questions, because there are resources out there that people should know about.
And I think the option to, again, teach your kids how to say no or how to get themselves out of a bad situation if they're in it. That having that code, come and get me, or having them, if they can't go to their parents, that they have a relative or a friend that they can go to that can help them.
And just something else, thinking about what you said. I know that my parents always talk to me about, like, if you're in a party, get yourself out of a bad situation. But they never said to me, if you need help, come to me and talk to me, and we can try and work together and use all the resources. So that might be a conversation that you want to have also. Yes, if you're in a dangerous situation, but you're young, if you make a mistake, if you're nervous, if you're not sure, if you need some help, like, it's okay to talk to me and we're going to work together, is a really important message for your youth as well.
Mm-hmm.
Can I say one thing also about this from the other point of view of, there are a lot of parents here who have children who have substance use disorders, who have lost children to substance use disorders. And I think the prevention message is critical, of course, but I think we have to be careful not to imply that you could have done something differently than you did, because I think that gives parents an element of shame that they don't deserve. Yes, these programs are important, and the more information we have, the more important, the more likely that maybe we can catch some of these kids before something goes wrong or something awful happens. But I think it's really important to recognize that we have, to use the word heroes in this, it sounds like not enough, but I've met a lot of the people in this room that have either lost children or are dealing with children with substance use disorders, and they are learning a lot really, really fast under really emotional conditions, and I applaud them, and I don't want them to ever to feel that there's something they could have or should have done differently, because I don't think we've really figured that out, and we could.
And I was talking from the prevention aspect, so I hope that I didn't make anybody, because I totally agree.
The young people are finding their medication or these drugs a couple of different ways. One is through a prescriber. If they have an injury, they're given an opioid, or they're just experimenting with friends and they find it that way, or they find it in a medicine cabinet. Angelo and the partnership have done great work on educating parents about where kids get their drugs, and it's an amazing percentage of young people who find their first pill in the medicine cabinet, whether it's your medicine cabinet or their cousin's medicine cabinet or their neighbor's medicine cabinet. That's where they're finding them. And so, that's one message. But let me just say that it doesn't matter. Most parents love their kids and they have good relationships. And I have met families who love their kids. The daughters, the sons love their parents. Great relationships. Whether they have money, they don't have money, whether they live in a fancy house or not. So it's not the parents' fault. They just didn't know. We were all young at one time. And for me, it was a little while ago. But, we were pretty good at lying to our parents or, bending the truth. Where were you tonight? What did you do tonight? Even the best kids. We're kids. We just make mistakes. And so you can't, Bonnie's great message that Bonnie just gave us, which is don't blame yourself. Kids are pretty creative, right? Kids can be pretty good liars. Right, prosecutor?
Yes.
But not in a manner that's mean-spirited. It's just that they don't want to get in trouble. They don't want to disappoint their parents or disappoint someone else. And so this is just a process. And unfortunately, I've met a lot of parents who they've had great kids, great relationships, but just it happened. It happened because they were prescribed this poorly, too much of it, and there was never a follow-up, or they found it in a medicine cabinet, or they found it through their friends, and they just began to have fun with it, and then it was just too late.
Thank you. Next comment over here.
My name is Dr. Michael Spadafino. I'm past president of the Association of New Jersey Chiropractors. In a time like this, when there is a crisis, I think that it's very important that we utilize all tools that are available for us. I believe that natural healing arts has been very underutilized, and we need to have a good partnership between mainstream medicine and natural healing arts in order to be able to combat this type of problem where it starts. Medical doctors have got to have a better knowledge and understanding of the alternative medicines that are out there, so that the first thing they do when somebody has a nerve irritation or a joint problem that has inflammation, and instead of giving them anti-inflammatories and offering them the opioids, that maybe they should more quickly look to alternatives such as chiropractic that deals with joint function and relief of nerve pressure without any types of medication. Also offering the possibility of having better knowledge of nutrition so that they can go to a nutritionist who can teach them how to deal with an inflammatory process in their body without having to rely on opioids for relief. Also, there's great information out there about the functionality and use of acupuncture, along with psychology and along with physical therapy, in order to be able to have natural healing arts, to be able to combat this problem and stem it from the beginning before it becomes a problem. This is not going to be able to address people who want to find a high and be able to get to have a joyride, but for the most part, we all know that it is from an injury or from a prescription from a medical doctor that gets it into the medicine cabinet in the first place. So we need a good partnership with mainstream medicine to be able to focus on how to get relief, how to get recovery without having to use opioids.
Bert, I think that, I mean, since this has begun, we have really worked closely with the medical community, at least legislatively, through our strategy to talk to the prescribers about this issue. And whether it's hospital-based or it's in the emergency department or it's in a physician's office, to get the message to them. Now, there have been some bills that I've written, the governor signed that, with by and large, the medical community went kicking and screaming along with the legislation, because they believed that we were sort of getting in between this doctor-patient relationship and telling them how to prescribe or how to practice medicine. And there is a fine balance between all of that, but there's a time where good public health and good medicine intersect. And to be able to limit the amount of a prescription, which we did this year for an acute pain, to require doctors and prescribers, even advanced practice nurses, to go on to there's a website, the prescription monitoring program, they're now required to access when they write a prescription for the first time, to make sure that their patient isn't doc shopping or diverting it, either taking it for themselves or they're diverting it for sale to someone else. That was a Herculean effort to beat back the medical lobby, because they opposed it so strongly. But, common sense prevailed, and now it is that they're required to do that. In terms of the other issue on physical therapy, that's absolutely important. The default should not be an opioid. It could be, and we don't want to eliminate the prescriptions of opioids. It just has to be done more responsibly. There's a hospital in North Jersey, I don't know if it's wholly named or another hospital, that they've gone opioid-free in the emergency department.
St. Joe's.
St. Joe's, unless your leg is falling off or something. But generally speaking, they've eliminated opioids in the ED and have opted for other things, non-opioid relief, pain blockers, and other ways in which to treat pain. So the medical community is getting on board. They're all on board. I mean, they don't want to see this happen. But changing behavior and changing practice patterns for some has been difficult, and that's coming along.
Okay. Next question.
My name is Dominic, and I was wondering if instead of thinking about limiting amount of days of getting the prescription opioids, you would think about limiting amount of pills of opioids. Like instead of 20 to 30 pills, in like 5 days, like 5 to 7 pills, decreasing the amount of addiction.
Yeah, the legislation does address that. So they'll give you just, 5 days worth. It doesn't mean it's 50 pills. It's a few. So if you have a wisdom tooth extraction or something, a short-term broken bone or whatever it is you have pain, it's just a few for a few days. And if you need more, you have to call the doctor before you can get any more, and then you have a discussion about your pain, whether or not this is for real or something that you're either imagining or you want to abuse. That's a good question.
Yeah, and just to follow up on that, if I could, Senator, there's also, was there legislation either in the works or already passed that would almost mandate that the doctor explain to the patients the risk that addiction could come along with that? Is that something that's being done also?
Yeah, and that was another one of those issues that, the medical community came kicking and screaming to support, or not to support, but they were just kicking and screaming because, again, we were interfering with the way in which they interacted with their patients, so they said. And the Partnership for Drug-Free New Jersey was the main catalyst really driving this as a matter of public policy. And speaking to my colleagues about the importance of doing that legislation, which is to say that first we started off for someone who was a minor, and then it was for everyone who was prescribed an opioid for the first time. You have to have the discussion with them. Because I've talked to, and we know Angela's here from the partnership, and Elaine and Stephen Pizicki, who are good friends of mine who lost their child, had no idea that the prescription that their son was given because of a lacrosse injury would eventually lead to his the death from a heroin overdose. And so having those discussions is important. Not every time, but the first time you prescribe it, and then when there's a refill. If they come back for a refill, again, to have the relationship, or rather have the discussion, to educate them about the risks of what it is that they're being prescribed, if they're being prescribed it. And if it's a parent, certainly with the parent as well, or their guardian.
All right, thank you. Next question.
Hi, my name is Beth Balaban, and I am a community liaison for High Focus Centers in New Jersey. First of all, I want to thank all of you for coming out and sharing your experience in what's going on in the current climate. My question to you is that there's 21 counties in the state of New Jersey, and each one of you represent, I'm assuming, Middlesex County. Have you had the opportunity to collaborate and work with your partner position in the other 20 counties? And if not, what can we do to connect you? I'm on a committee in Cranford, New Jersey. Our sole purpose is to figure out how to get parents to come out and learn about what's going on, not just with the opiate epidemic, but with vaping, with electronics, with all of the things that are affecting our adolescents' brains to create an atmosphere that's prime for addiction. So again, my question to all of you is, have you had the latitude in your positions and the opportunity to work with your counterparts in the other counties to find out what they're doing, what's working for them and what's not working for them? Thank you.
As far as the prosecutors, the 21 of us prosecutors, we get together on a monthly basis. We do corroborate. We talk to each other. Ocean and Monmouth, Joe Coronado, Chris Gramiccioni, they kind of led the way on this with the Narcan. We do collaborate. And in terms of law enforcement in New Jersey, we have a very strong Attorney General's office that coordinates all of our efforts. We have legislative liaisons that speak to our senators and our assembly people to try to coordinate our efforts. And as well, we reach out to our federal friends as much as we can. We get briefings from Homeland Security. I myself talk to DEA, FBI, and so we reach out nationally, internationally. So while I'm the county prosecutor, there's no border at the county line, and we try very hard to reach out to everyone and anyone we possibly can. It's a good question.
I just want to add to that, that the purpose of the town hall series was to do just that, was to allow people from a county by county perspective to understand the issue locally, but to look at some of the best practices that are taking place throughout the state of New Jersey and to share those best practices with other counties. So at the conclusion of the 17 town halls, which this is number 13, what we'll be doing is having a statewide event where we're going to be bringing together the best practices that we found as a result of these meetings. So these meetings are exactly what you're describing, and we appreciate that question.
So there are prevention coalitions in most of the counties in.
Go around to different areas of the state and kind of share your personal story and talk about the path and the journey that you've been on and talk about resources that are available. Has that happened for you?
Absolutely. So I actually do work for a treatment center. It's called Victory Bay Recovery Center. And right now, tonight, I see a lot of familiar faces in the audience of people that we do work with that are from other treatment facilities, such as High Focus. I actually met with Mary today. She's part of Pyramid, the umbrella company. So yeah, we all do work very, very closely together. But I also understand, first and foremost, I'm so sorry. I'm so sorry for your loss. And when I hear you speak, I hear my mother, right? And I think that most of us in recovery can identify with that. But I want you to know that your daughter's death was not in vain. And she is the reason why I get up here and I do this. And she is part of everything good that I do. I want you to know that. I think that it's my responsibility as someone in recovery to give back as much as possible and help the next person who's trying to get help. The IMD exclusion, I actually testified in front of the Congress about the IMD exclusion because that was part of my story. When I wanted to get treatment, it was another barrier that I faced and I couldn't get into treatment. So I would stay with my mom for weeks at a time, calling day after day after day, trying to get into a treatment facility. And that one moment of clarity that I had to decide when I decided I wanted to stop getting high, and I was turned away. There was no beds available. And so I did testify in front of that. I have participated in the Reach NJ campaign. I go to Washington, D.C. very often. I participated on the President's Opioid Commission as well, where we did meet with doctors and insurance companies, where they were trying to review other things that they can do as well. This has become my life's work. And I couldn't thank you guys enough for actually showing up. That's the first step in all of this.
Thank you. Next question or comment, please? From the mayor.
Well, I'm not wearing the mayor hat. I'm going to wear the doctor hat for a couple of seconds. First of all, I want to thank everybody for coming here tonight and talking about what I think is an extraordinarily important topic. I do believe that the most important thing that we need to think about is how to be proactive and try to help prevent problems before they occur. Most of what we're hearing tonight and need to have the discussion is, but it's mostly reactive. What the government's going to do after we had a problem, what the prosecutors are doing after a problem was identified, what we're going to do for those patients in treatment, what the insurance company is going to do, and is it going to be 15 days or 28 days? That's all after the fact. And we need to be concentrating on those conversations that occur in the home, between parents and between children, before the problem ever occurs. And the reality is that neuroscience, as the good doctor can attest, is extraordinarily complicated. We know a whole lot more today than we ever knew before, but what we don't know is even greater. Why certain people will get addicted after 2 doses of Percocet and someone else could be on chronic treatment and never get addicted. Why some people react to certain medications and will respond and others won't. Why your mother will see you walk down the aisle and this mother won't see her daughter walk down the aisle. We don't have those answers. So we do need to do a lot more work and a lot more investigations. It's going to take years to get that, but that's not going to stop those conversations from occurring in the home where you're open and honest and can talk to your children about those things that they need to avoid. And that's why these type of discussions, these type of forums, these type of opportunities to talk about this is really educational, and hopefully your daughter's death won't be in vain, that maybe this discussion helped prevent thousands of other people from ending up in the tragic position that you're in. You're very brave to come out here and to talk in front of this audience. I don't like the blame game. You know, I don't think that it's all doctors' faults. It's the same government that I remember about 10, 15 years ago saying that pain was a vital sign, and doctors weren't recognizing pain at all. And so nurses were told to do pain on a scale of 1 to 10, and the government was forcing us to recognize that people have pain problems, and as a result, we started prescribing more because we were reacting. Doesn't help. Now we have a opioid problem because we've actually now the blame for having overprescribed medicines and done that as a knee-jerk. There's no one answer. It's not one problem. It's going to be a community problem, and it's going to be a community that's going to solve it, but it's going to start in the home And it's going to start by those of us that are here tonight telling other people about this problem. It needs to start from those very, very, very basic conversations that you have between you and your children, and that starts with dialogue, and that's proactive, and that's the beginning of the, at least what I believe is the solution, because the answers are a bit more in the future than we have right now.
Thank you. Next question or comment, way in the back.
Hi, I'm Bill. I'm a certified drug and alcohol counselor. I'm Bill. I think it's noteworthy to note that there's nobody from the pharmacy industry, the insurance industry, or medical doctors here who I deem to be the real culprits of this epidemic. You know, I think one of the biggest issues is, you know, we can talk about parents and things and blame the parents, but I think it's up to the individual. I've been to many facilities, inpatient treatments, and they're not all the same. And the goal of most of the patients there, and I'm saying this firsthand, is not for treatment because, number one, they're in denial. They kind of think they don't have a problem. It's everybody else. And number two, their goal is not to get sober. It's to be cool. You know, and I've witnessed it, and it saddens me. But that's the reality of it. And speaking of the reality, you know, you can talk about evidence-based, and I fully understand that. But the bottom line is most people don't get it at any one time. You know, they're not ready or whatever. And we have to keep trying, and there's no system that works. You know, I've been in the criminal justice system, methadone treatment, inpatient counselor, and all that. And everyone works to an extent, but all of them, none of them are really good. I mean, we're not talking 95% success. We're talking 12% might be a good success after a year after discharge. But it's you got to do something. Thanks.
Before that's addressed, just in the interest of full disclosure, there was a medical doctor who was scheduled to be with us here this evening who was called out for a last-minute medical emergency. In previous events of this that I've hosted for the partnership we have had, the medical community has been represented. Anyone like to address his concern?
Well, I just want to say we do have members of the medical community here, and we have members of the insurance community here, so people are engaged.
Also, as someone that was in treatment, I understand where you're coming from and exactly what you're saying. It is a culture change that we have to make, and I think that as somebody that participates in a 12-step program, that's something we're really, really trying to do. Medicaid-assisted therapy or treatment is really important as well. The rates are actually a lot higher than 12%. So, but I have sustained completely from drugs and alcohol for over 3 years. But just because that's not my story, I'm not going to look down on somebody else that has a different story but has the same results. And I think that's another stigma that we have to cross as well. And exactly like you said, we have to do everything and anything that it takes to get somebody sober. I don't think that an insurance company can dictate someone's treatment, but I also think that a full continuum of care is very important, and that also has to be taken upon the client or patient themselves. They have to decide that they want to participate, have a full network of recovery, and also change people, places, and things. I think those are very crucial to long-term sobriety.
You know,
Thank you. Next question over here.
Hi, my name is Emily Gray. I'm a treatment advocate with Recovery Centers of America. I want to thank you all for being here. I appreciate your dedication to the topic. First, I want to make an observation. I go to a lot of town halls and events like this, and I think it's quite interesting that when we're talking about a brain disease, a mental health disease, and we have a panel, and this is not a critique of the event because I am so grateful for all of you up there, but I think it's interesting that we have, out of 6 people, 1 clinician on the board. And the reason why I bring that up is because, you know, we talk about overprescribing, which is a huge problem, and we talk about the lack of insurance coverage, and that's a huge problem, and getting rid of our pills and prevention and things like that, and these are all really big aspects of the problem. But one thing we have not talked about tonight is causes of addiction. And they say, you know, there's a lot of people out there that believe that you don't know, there's no way to know if someone's going to be an addict. But what research tells us is that there's a statistically significant relationship between addiction and trauma, between addiction and untreated mental health disorders, and between addiction and adverse childhood experiences. And the reason why I say that is because all of those things require extensive therapy, right? And if you're sending someone to treatment and their insurance company is telling them that after 15 days or 21 days they're ready to go home, they have not received enough treatment to even scratch the surface. And another reason why I'm bringing that up, and I don't know if one of you might have an answer for me. Okay, so now some of these treatment facilities can take Medicaid because of the waiver. That is fantastic. This is something I've been hoping for a long time. But my question is this. Why is it that New Jersey's Medicaid pay rate is less than what it costs to get a hotel room in this state? And that's not the case in other states.
Well, the Medicaid rate in New Jersey is depends on where you're talking about. So there was more money put into the provider community this year for rates for addiction and mental health disorder. New Jersey is one of those states that the federal government considers to be wealthy compared to others. And so the reimbursement for the match, the federal match, Medicaid is a federal program, and we get 50 cents on a dollar in most cases, and some of it's a little bit more. Now that we had the expansion, but states like Mississippi and Alabama and some others they're getting 90 cents on a dollar reimbursed for every dollar they spend. So this is a federal issue that New Jersey would love to solve, but we're looked at as one of the wealthier states, and so we guess we can afford to pay more for our services than other states can. And the IND waiver is important that we got the waiver, but if facilities don't accept Medicaid, even a little bit, then the waiver is just, it's not helpful. And it's just an empty promise. Until we increase the rates, then we can make a dent, particularly for that community. The majority of people who have insurance, commercial insurance, can get into treatment at some level, the majority of them. Unfortunately, in New Jersey, only 30-some-odd% of our insurance companies are regulated by the state of New Jersey. The other are self-funded plans. So if you're a member of a labor union or a large company who self-insures, those are federally regulated, and nothing we can do can make them cover mental health or addiction services. So literally 30-some% of the marketplace, the commercial insurance marketplace in New Jersey, including the Affordable Care Act and Obamacare, are the only ones that we can have any control over in terms of what they must offer. And so you've got 30-some% that can get insurance coverage for an addiction, for substance abuse disorder, and that was still a little bit of Medicaid and Medicare. But the vast majority of New Jerseyans don't have commercial insurance, and their companies or as a matter of policy, may or may not offer substance abuse treatment. Could be a little bit, it could be a lot. It's expensive. And so that's another issue that we have to overcome, or at least not overcome, let's not raise our expectations, but at least try to address. But we can only, when we mandate that all women shall get access to mammographies, or all men should get access to prostate screenings and whatever. I mean, those are rules and laws that we pass that only affects about 35% of the marketplace, because the rest of it is a marketplace that we can't regulate because they're federally regulated. So, not to be, depressing, but we're doing the best that we can with the resources that we have, but we can always do more. And lastly, and I think with Bonnie could weigh in on this a little bit too, is the emphasis on residential treatment. It is important, but it's not for everyone. And if we don't talk about medication-assisted treatment like Suboxone or Vivitrol or something else like that, then we're really not going to help as many people as we could. There has to be follow-up when someone comes out of treatment. A supportive family, if they don't have one, then needs to have some connection. Insurance plans can play a role in that in terms of their care management. Like what happens when someone is released after 28 days in a facility, where do they go? They're coming back to New Jersey. If they're sent to Florida for some ridiculous reason, an airplane and a limousine to the facility, and they come back to the airport in a limousine and go to an airplane to go back to New Jersey, where are they going after that? What's their care plan? And if they don't have a support structure at home, they're up against it, right? They want to remain sober. They want to, get on with their lives and try to help themselves. But we need to. That's a whole piece of this is disjointed and needs to be really fixed, I think, and acknowledge that it's not just only residential. 28 days and you're out, you're fine. It's not. 28 days, you may come out, you need to have support services, maybe Suboxone. There are some facilities that frown on Suboxone. They won't prescribe it. They won't allow it. I think it's absurd that a medication that can make someone, allow someone to function, go to work, go to school, be a good family person, drive a car, and remain sober, isn't permitted. So there are lots of challenges.
Thank you,
To your
Senator. We
point-
have time for 2 more questions, and then
Before
we'll
we,
wrap up.
before we move on, just your point of addiction and mental health is not lost on anybody up here. It's finally we recognize that we have to treat both at the same time, the cause and the effect, and figure out what's really going on. I have a very close relative who has been in rehab 3 or 4 times at this point, and it's very expensive. And the first time he was in rehab, he called me on day 10, and he said, they will not talk about my anxiety. They have told me they need to get me off the stuff first. But the reason he was self-medicating was due to the anxiety. We recognize that that's something we have to do together. For our police officers in Middlesex County, we've instigated crisis intervention training to deal with people in mental crisis, to deal with people that are dealing with drug problems. And once we instigated that training for all of our police officers, we realized that the police officers themselves need support. 30% of our police force is made up of veterans. These veterans are coming back with some very serious issues, and I want to help them as well. So the mental, the physical, the addiction, it all goes together, and our heroes in blue, they need our help too. So it's everybody coming together to address everything. Appreciate your point.
I want to agree with that, you know, we're here now because we've said, I mean, I have a clinical background, and I've been fighting these policies for years. That's why I went into the legislature in the first place. But the fact that it hasn't worked, everyone has come together and said, we can't do it alone. We have to do it as a community.
All right, 2 more questions. We'll go to the back row for our next to last question.
Hi, my name is Nimai. I'm a sophomore at the high school. And, well, first off, I want to thank you. I know everyone's been saying it all night, but I really want to thank you for coming out here. And I see a lot of people, so I'm really happy that you guys actually came out to see this. And I'm happy you're here to educate us on this, so thank you for that first. I'm with the Youth Council, and I've been to a few of the East Brunswick Municipal Alliance meetings. And we started discussing one topic recently, and I want to see your opinions on it, the idea of having drug screening in schools. So I want to know what your opinions are on having these random drug tests in schools, or like the problems with it, why it's good, like what results you think it would yield.
So I guess depending on like what, like, so if somebody is drug screen positive, what's going to happen? Are they going to have a punitive like suspension, or is there going to be some kind of treatment and intervention? I think that, you know, weighing kind of why that like might kind of sway me either way. But if you're just going to drug screen, you have a 0 tolerance policy and it's like you're suspended, like absolutely not. You're not helping someone.
Well, you don't suspend somebody for a medical illness. If someone has diabetes and they
Right.
don't take their medication, or they have some other illness, asthma, they don't take their asthma medication, you're not suspended from school. And you should be suspended from school if you have a drug or an alcohol problem. So early on I talked about this SBIRT program, and don't ask me to tell you what the acronym stands for, but because I've read it 1,000 times. But it's substance abuse and it's referral to treatment. It's early intervention and referral to treatment.
Yeah.
So that's something that we're going to be, thank you, that's something we're going to be doing hopefully in the coming months and years in New Jersey schools, is to be able to, in health, when the school nurse or the substance abuse counselor or someone else can have a conversation with every student in the school over a period of time and identify students who are at risk. And when they're identified at risk, then there's the opportunity for an intervention. An intervention looks like talking to the parents, talking to the student especially, but talking to the parents. You can't force a drug test on a student, whether it's, unless it's part of being part of sports or something in college. But in terms of high school, there's constitutional issues. There are parent issues in terms of being able to, or signing off on something like that. But we don't go there. We want to be able to, in a manner that's appropriate and based on evidence, which is to talk to these students and identify if it is that they're at risk and what to do about that if they are, which is first to have a conversation with the parents and look at the model that we saw in Gloucester, Massachusetts, The entire school board, the school district, the mayor, the council, community leaders all bought into this system. And they literally brought hundreds of people into treatment, young and old. And so I think your question is a great question, what to do about students who either self-identify or identify by being at risk for drug or alcohol abuse. And that's a program I think will make sense. Thanks for that question.
All right, thank you. We have time for one final question. We'll take it from right here.
Hi, my name is Aarti. I'm a medical graduate from India. Actually, I feel all the causes of this addiction is due to the inability to cope up with the stress. So I feel there should be programs at the school for de-stressing the students like yoga or healthy mindfulness. That's what it is. Thank you.
And I think that's why I'm such a big advocate for prevention. We talk so much about recovery and treatment, and we need to, and it's so important. But prevention is really, really important as well. And I think that sometimes because we're reactive, like the mayor said, we don't necessarily focus so much on prevention. But a lot of what we do, money has to go towards prevention and time has to go towards prevention, because that is, as important on the continuum of care.
Critical. Critical.
Yeah, it's very critical, absolutely. We forget about it sometimes, so I need to be an advocate for prevention.
All right, thank you all so much for your terrific questions tonight, and also thank you for joining in the conversation here this evening as well. Thank you to our panel for their tremendous information that they provided here tonight. We want to thank them for spending some time with us this evening. A reminder for you that additional information is available at the tables in the back. Resources are available also on the event website. Also, please be sure to complete your survey. Return them to the partnership staff as you leave, and also visit their website for information on the upcoming town hall events and also for the Shout Down Drugs Concert 2018, which will be the biggest and best one ever. So thank you for being here this evening. Arrive home safely, and thank you again.